Hello and welcome to another engaging and insightful episode from the Bakersfield Health Channel. As always, we will be discussing the many small efforts that you can make right now to live healthier, both in the short term and to benefit from significant results in the future. My name is Dr. Kumar and I'm a board certified cardiovascular specialist. I'm the medical director of the Heart, Vascular and Leg Center here in Bakersfield, California. On today's show, we'll be looking at diabetes in general, as well as various complications that can arise for patients. My guest is Dr. Chen Park. Dr. Park is a board-certified doctor of family medicine and also the founder of Vanguard Medical Corporation. It's a pleasure to have someone of his experience and talent on the show here. Dr. Chen Park, thank you so much for joining us today. If I may begin with a general medical question that relates to all patients, why is it so important for patients to go for regular checkups?
As the saying goes, it's better to have an ounce of prevention than a pound of cure. So as it makes sense to take your car in for your regular tune-ups or oil change, it makes that much sense to take your body in for a regular checkup as well.
You know, we always enjoy asking our guests a simple but life-changing question. Why did you want to become a doctor?
I was exposed to medicine at a very early age. I was 8 when I came to the United States, but my father was somewhat ill. He had high blood pressure, congestive heart failure, and a triple A, what they call an abdominal aortic aneurysm, and that is the eventual cause of his death. I was the one that was responsible taking him to his doctor's visits, as always, also providing translation for him. So I saw some good doctors, I saw some not so good doctors, and decided that, you know what, this is something that I could do, and decided to become a doctor.
And I see that you have grown your practice and caring for the patients and eventually founded Vanguard Medical Corporation. I noticed there is a belief in educating patients, not just treating them. Why is this idea so important to the practice you have founded?
Okay, our corporation's mission statement is Bridge to Health and Wellness. So I've always believed that, as a medium or being a doctor, means not just a healer, but if you take the original meaning of the word, doctor means to teach. So providing that education and providing that resource for the patients to a healthier lifestyle is the purpose of being a doctor. And the key concept nowadays is the infrastructure. And being a bridge means providing that roadmap and also providing that resource so that patients could get to the other side, which means health and wellness.
Wonderful. Talking about the educating patients, I was, when I was in medical school, we learned diabetes is a disease of the high blood sugar. But now, as we have seen over the last 10, 20 years, diabetes is really a disease of the vascular system. It causes generalized plaque buildup and atherosclerosis, and that's what causes most of these problems and complications. So why some people develop diabetes, Chen?
So yes, I would definitely agree with that statement. So we always try to prevent the complications of diabetes, which is we initially thought was just a microvascular problem, so affecting the eyes, affecting the kidneys, and affecting the end organs like your feet and your toes, or your fingers and your hands. But we realized that it also involves the macrovasculature.
Absolutely. Just like, patients with diabetes will have blockage in various systems, whether this is the coronary artery disease or carotid artery disease causing stroke, blockage in the heart arteries causing heart attacks. They have the kidney arteries problems, and eventually these are the patients who end up needing dialysis. They have the peripheral artery disease, and they're the ones who develop these sores and ulcers and eventually need amputations. As serious as diabetes is, Dr. Park, what causes it?
So the issue basically is lifestyle. So sedentary lifestyle is the cause. So people have ready access. We, as the saying goes, fast food, and we have fast cars. So people eat what they want, but don't do the exercise that's needed. So my wife's philosophy is actually very simple. It says, if you want to eat, you better exercise. But most of the people's concept is that, well, I'm going to eat and then I'll exercise. But it should be the other way. In order for you to eat what you want, you definitely need to have the exercise component.
And Dr. Park, many of these patients, they keep eating, not exercising, they don't have any symptoms. Diabetes these people, many of them, and most of the time, they don't have symptoms. How do these patients and people find out whether they have diabetes or not, and what are some of the early symptoms?
So these symptoms that we tell patients will be to look out for will be signs of being thirsty all the time, being hungry all the time, and drinking, over drinking. So those will be what they call the 3 Ps of diabetes. But basically, if you want like more objective kind of things without checking your sugar, would be if you have like a frothy urine, those kind of things, extreme thirst, those things will be what you need to watch out for.
How do we diagnose? Let's say a patient comes to you and they don't even know if they have diabetes or not. Like actually, over 10 to 20% of these patients, they never find out whether they have diabetes until the very late stages. So what can be done for you to diagnose these patients early on?
So nowadays, we go by the strict diagnosis of or criteria of if your fasting blood glucose is greater than 126, that's considered diabetes. There's also a random sugar that's greater than 200 with those symptoms that we mentioned, the 3 Ps. But there's another test called the hemoglobin A1C, which is a test that kind of gives us a better way of gauging how the average sugar has been over the past 3 months. So hemoglobin A1C of less than 5.6 is considered normal. Between 5.7 and 6.4 is considered pre-diabetic range. Anything greater than 6.4, 6.5 and above will be considered diabetic range.
I think those are very simple definitions that we use to diagnose diabetes in any physician's office. So once we have diagnosed, we have medications, and if patients have insulin-dependent diabetes, they may need insulin. In addition to giving medications, what else can be done to treat these patients? How the patients can contribute to control their own diabetes?
So basically, we like I said, the goal of diabetes management for physicians is to prevent those end organ damages. But for the patient's perspective, we want to improve their lifestyle and then turn around and improve their life by limiting some of the things that they're doing wrong and probably trying to accentuate the things that they're doing right. So it's sometimes hard to kind of convince the patient to completely change their lifestyle overnight. So it is not realistic to say, for example, if you're a meat eater to become vegetarian, if you like pasta to give up pasta. So I usually say, realistically, cut down your portions. It doesn't mean because you're diabetic, you can't eat your ice cream. You could have your ice cream, but maybe not every day. But cutting down your portions, like I said, improving your lifestyle so you become more active, exercising, so that you could have your cheat day or have your ice cream once in a while, that kind of a thing.
So one of the things that we always try to prevent the complications, as you mentioned, some of the commonest complications and we fear about, and most of these people die from the vascular complications like the heart attacks or strokes. So how do we diagnose or treat them early on before they even develop those complications?
So sometimes, we would consider high blood pressure or even diabetes somewhat as a silent killer because we don't really know. But sometimes we get a little clue. So people who have, for example, arterial disease in their legs, and if you're a diabetic, you're more likely to develop that. Sometimes you lose hair, or you don't have normal hair growth in those legs, or you check for pulses and you don't feel the pulses correctly. So those will be the signs, and you will confirm that suspicion by ordering tests, what they call an ankle brachial index or peripheral artery angiograms, things like that, to diagnose that any kind of a circulation problem.
And Dr.
Same thing goes with the heart, of course.
And so the early diagnosis will lead to early management and treatment, I think, and that may be one of the ways that people with diabetes can stay away from complications and having an early mortality and morbidity,
Definitely. So prevention will be the key, but if we are beyond that in terms of, they develop diabetes now, what do? We want to, once again, prevent the end organ damage, stay ahead of the game by getting your regular checkups, getting those diagnostic studies if you need it, so that someone like Dr. Kumar could intervene. So if there is a complete blockage in those arteries, you may not be able to, stent and things like that. Same thing goes for the heart. But if we're able to catch it at a stage where we're able to intervene, that is a life-altering event.
Well, that's so wonderful, Dr. Park. I think, so if I summarize what Dr. Park has educated our listeners and viewers today, he mentioned diabetes is a silent killer, may not have symptoms, a good history, examination and a routine blood test can diagnose this disease A fasting blood sugar of over 126 and an A1C level of over 6.5 can easily help diagnose diabetes. In addition to treating with medications, he stressed the importance of diet and regular exercises that are critical not only in managing the disease but also to prevent the complications like heart attacks, strokes, kidney failures, peripheral artery disease and gangrene, and we can prevent amputations as a result. Once again, our sincere thanks to Dr. Chan Park for joining me today to discuss diabetes and related complications. As always, this podcast is brought to you by the Bakersfield Health Channel. Feel free to share this show with anyone you may know who could benefit from the information we learned today. You never know, it may just ease some pain and be the helping hand someone needs. From myself, Dr. Kumar, and the Bakersfield Health Channel, may you walk stronger and live long.